San Diego County health officials have asked for more than 26,000 doses of the monkeypox vaccine to deal with the current outbreak. So far, our county has received less than 1/5 of what they want. We're going in depth to explain why the distribution of the vaccine has been frustratingly slow for doctors. When the first cases of monkeypox started appearing in May, the U.S. government already had millions of doses of an effective vaccine sitting in storage. But getting those doses to clinics has been challenging.
We need more vaccine, and we need it now.
So far, healthcare providers in San Diego County have only administered about 3,000 doses of the monkeypox vaccine.
States don't really know when vaccines are coming. It's kind of a day-to-day thing. And it's not like the COVID vaccine rollout in a long shot.
With the COVID vaccines, the CDC has been managing distribution, and the agency's detailed V-Track system lets states track and reorder vaccine supplies. But with monkeypox, the government is repurposing a shot originally designed for smallpox. The government stored millions of doses of that vaccine in the Strategic National Stockpile in case of a bioterrorism attack. The stockpile is overseen by a different agency, the Department of Health and Human Services, and they use a system that was designed for one-time shipments, not ongoing orders. State officials have had to track doses manually, and until recently, they had to order them via email, not an automated system.
I'm super frustrated.
Dr. Peter Chinhong is at UC San Francisco, the first region in California to see cases.
Seeing a lot of people with sickness and suffering really makes me feel sad because, again, it's something we have the tools to do. And it really shows us the importance of a system and a well-oiled machine.
Within California, it's the job of the California Department of Public Health to distribute vaccines to counties. And despite San Diego's size, it ranks 5th in the number of vaccines allocated.
We've clearly have not gotten much of that in San Diego, and we need much more.
Dr. Francesca Torriani is the director of epidemiology at UC San Diego Health. She says the state uses formulas to allocate where to send vaccines. Those formulas look at cases of monkeypox and cases of the STD syphilis among men. Monkeypox is not classified as an STD, but it has been closely linked to sexual activity, primarily among men who have sex with men. And for now, public health officials think syphilis cases are a useful proxy. And the Biden administration announced yesterday it will start distributing another 500,000 doses, which is twice as many as expected at this stage. Last week, the FDA changed the dosing of the monkeypox vaccine, which makes up to 5 times more shots available.